So to move to the next piece, which is the guideline development path. So I'm going to talk through the elements that we see that are important, and I expect you will see are important as well. Some of the tools that we have and that we're building. So we do have a guideline development manual, which we are building to be a bigger resource. So that is available, and I'd encourage you to have a look at that. And I'll go through the stages of the path. So for us, we see 6 stages in the guideline development path. So that's planning the guideline, developing the guideline, which is probably the biggest stage, the dissemination of the guideline, the implementation of the guideline, the evaluation of the guideline, and also then the revision of the guideline. And what we would like to see is that the guideline isn't just about the development of the guideline, it's about the whole process. So it is a closed loop, and that each piece is as important as the next piece, because if we only concentrate on developing, we will forget about the implementation piece. There's no point in us having a beautiful clinical guideline that's fantastically developed with the greatest resources if it's not actually implemented in the system. And in fact, it's highly risky to do that because we're creating a standard then that can't be met within the system. So it is important that we're very, I suppose, practical and reasonable about how we address and move this forward. So firstly, for yourselves, and some of you will already select your guideline topic, and for those of you that haven't, I would urge you to read through our prioritisation process. Go through each of the elements as we've described previously. See how your topic is going to meet the issues around patient safety, burden of clinical topic, evidence analysis, economic impact, variability in practice, potential for addressing health issues, and clinical guideline implementation. I was just going to give you a little example here because it's really important that as you think about what you're approaching, that you're very clear about what your guideline title is. So it does what it says in the tin, to use the analogy, what the guideline covers and what the guideline doesn't cover, because no guideline is going to cover everything. So within the scope of your guideline, you literally need to have a section that has what this guideline is. For this, it's around pit and fissure sealants, what the guideline covers, and then what it doesn't cover. So give that some thought and look at some of the examples of the guidelines out so it's very clear to everybody who picks this up, whether it's a clinician, whether it's a manager, or whether it's the public. So before you start, go have a read of the Guideline Development Manual. It pretty much encompasses everything we're going to talk about today. We'd love your feedback on the manual because Rosari here is working on building it into being a bigger resource. I'd urge you to go look at the framework for endorsement of national clinical guidelines so you're clear about the whole process and the timing. And I'll mention the timing because for those of you who are looking to look for endorsement this year, particularly I'll take the example of the PEWS guidelines. So in order for us to put it through our processes, as you can see there, the quality assurance and endorsement, we will need this in a number of months before the planned finite date. So in some ways, a project management approach is really helpful to your guidelines. When do you want it out in the system, and start to work backwards and see what's reasonable and feasible, and be very clear about that to your stakeholders and your guideline development group, because there are often huge expectations that we can deliver these guidelines in a very short space of time. But actually, we need to be very realistic with people and say, if we want to do this right and do it in a different way to how we've put out guidelines before, this is the process and this is what it'll take and these are the steps. I'd encourage you to do the Agree To tutorial for any of you that haven't. It's on the Agree Trust website. It's only about 10 minutes. You're allocated your own avatar to go through it, and it's quite helpful in terms of talking you through the quality assurance criteria. Have a look at the HICWA National Quality Assurance Criteria for Clinical Guidelines and keep an eye out for the next version that will be coming along in the next number of weeks. Also, have a look at the guidelines for retrieval and interpretation of economic evaluation of health technologies in Ireland. Don't be put off by the title of health technologies. Health technology is around any intervention in the system. It's HICWA's guidance in terms of what needs to be considered around budget impact analysis. And they're actually working on a document which will be specific to budget impact analysis for national clinical guidelines, which will put in lots of examples of how other guideline groups have gone through, which I think will be very helpful to you. So we have identified the 6 stages. Within each of these stages, there's a number of steps. So to give you a brief overview, I'm going to go through each of the stages and some of the steps. I won't talk about them in detail, particularly some of that detail will be addressed later on in the other day or in other tutorials, or you'll need to go and read the Guideline Development Manual. In terms of planning, you need to clarify your content, you need to select your topic, you need to define your objectives and you need to define the scope. You need to identify your key stakeholders, which is very important, and I'm going to talk a little bit more about that in a minute. You need to consider your communication and your consultation plan. You need to look at and determine the kind of resources that you need. It really is very difficult to do this when you have busy clinicians working every day, all day. You need to see who can actually provide the support. And also, we need more than our clinicians. We need people like our resource experts, like our librarians here who are present today, other researchers to support the development of this work. And then we need to address and manage any conflicts of interest. So as you start, you need to think about who's around the table and are there any conflicts of interest there. In terms of stakeholder analysis, we give an example in our guideline manual of the very traditional stakeholder analysis matrix. I'd encourage you to think about that, and you need to think the broader suite of stakeholders. So while obviously for clinical guidelines we need the clinical leaders, be they our physicians, our nurses, our midwives, our allied health professionals, our physios and so on, we also need other stakeholders like your managers within your organisation, because if management isn't supporting the clinical guideline, well then implementation becomes very challenging. So think broadly around those stakeholders like your patient groups, your representative groups, and also other interested parties. Have a sense of how important they are to you in the development of your guideline, or how important they may be at the other stages within the guideline development path, like implementation, evaluation. It may be that your audit person within your organisation is really important to involve at this stage, at the very early stage of your guideline development. And as we all know, the earlier you bring people in, the more buy-in you do get. In terms of the guideline development group, again think broadly as to who needs to be on your guideline development group, and we provide some good guidance within the guideline development manual about that. So who are the key people that need to be there, and if they're not on the guideline development group, where and when do you need to consult or discuss or disseminate or communicate around the guideline itself? And the earlier you give some consideration to that, the better. And as I said earlier, we'd encourage you to think about getting 2 patient representatives on your guideline group. We don't underestimate the difficulty in that, because this is a piece of work we probably aren't as far advanced as they are in the UK in terms of including the patients and public in development processes. But I think it's an opportunity here to creatively think how we might involve the consumers of our service within our guideline development groups. We have a number of steps, 10 steps here in terms of the guideline development itself. So these are around defining the key questions, which takes a little bit of time to do in terms of what your clinical questions are. Searching in the first instance to see if there is a clinical guideline developed internationally that's of good enough standard to use. And you may find there's a whole guideline that's useful. You may find there's parts of guidelines. So your first search strategy should be to look at that, and then to start looking at the primary research and the quality of the research studies around your work. You need to screen clinical guidelines to see how good they are. You need to appraise the clinical guidelines utilising the Agree-to tool. You need to appraise other research studies to see how good they are, looking at the biases, looking at how well established or well set up the research studies were. And then you need to make a decision as a guideline development group whether you're going to adopt an entire guideline, whether you're going to adapt the guideline. And if you're going to adapt the guideline, we will direct you to use the ADAPT process. So it is a formalised process in terms of adapting a guideline. So it's not saying, oh yes, we'll take that or we'll take half of that. There's a formalised structure, rigour in terms of going through the guideline that you're considering adapting, or 2 or 3 guidelines you're considering adapting. And it is probably as much work as developing a guideline de novo, but it is certainly a good process in terms of being able to capitalise and utilise some very good work that's been done internationally or nationally, or develop a new guideline itself. So that's a decision you need to make as you start looking at the evidence that's out there, what's available to you as to how you're going to proceed. And that should be a formal minuted decision in terms of your guideline development group. Then obviously you need to prepare your draft guideline. We do have templates now for the guidelines. They're up on our website, they're in Word format. So we'd encourage you from the very beginning to start populating that template. It'll make it much easier at the other end in terms of publication. And we want all our guidelines to have a similar look so that it's easy for yourselves as clinicians to pick up, but it's also easy for the public to look at as well. And if you populate all of the sections within our template, you're very far advanced in terms of meeting our quality assurance criteria. We also look for the budget impact, particularly, and the implementation plan. And in terms of the budget impact piece, we can support how this is done. HICWA generally provide the oversight for that budget impact piece through their health technology section. But what is important in this is that we start identifying what's actually going to cost to implement this guideline. There's no point in saying this is absolutely what we want if we don't have the funds. So we need to start aligning any budget impacts with our HSE service plan, so we can start looking to any guidelines coming out this year. We need to already be thinking about the 2016 HSE service plan or the HSE capital plan, so we don't end up with a guideline with saying, if only we had thought about this or putting this into the service plan, we could have got a bit further. And then there are other pieces. So say, for example, if you look at the C. diff guideline, one of the recommendations based on the evidence and international experience is that we would have a single reference lab for C. diff. We weren't going to have that in place by the time we launched the guideline, but we clearly said that it needed to happen, and we provided the path for that to happen through the HSE service plan. So what we're asking you to think about in the budget impact is to think realistically what needs to happen for this guideline to be implemented, what resources are needed. Let's identify them specifically, see where we have them, where we don't have them, and where we might need to find them. And also, we find with the guidelines, as we've seen, there's a cost saving often with the guidelines in terms of standardisation of care. Then once you've done all of that and your guidelines ready, you need to communicate and consult. So you need to consult with your constituency and do that as a formalised process in terms of gathering their feedback, looking at the feedback and seeing what changes need to happen within the guideline. We also ask that you have international expert review in terms of the guidelines, and we encourage 2 international expert reviews, and we have a template and pro forma that can be used for that. We are a small country at the end of the day. Chances are within small clinical programmes we all know each other, so it's really important we get some international oversight and input, and that can take a little bit to set up, so it may be useful at this stage in your guideline development to start thinking about who would be good to provide that international review, setting that up, structuring that, so when you're ready to go for that, it won't delay or it won't compromise the project plan that you set out. Finally, we look to you to prepare the final guideline and to submit to us to come through the endorsement processes. So there are the stages and steps that, if you follow them, will hopefully help you through much more smoothly the development process. I just wanted to come back to the clinical and the key question. We recommend, and I think when our librarians speak, that the PICO format is utilised and that you think about your clinical questions. And actually, we've had this discussion you raised about the clinical practice guidance as to how, whether you're developing a protocol or something else, you need to be thinking about the research question. And in fact, the PICO format is a very practical, useful way to do that. So in terms of defining your population, in terms of defining your intervention, your comparator, in terms of providing or of identifying the professional group, the outcome, the healthcare setting, and so on. And I just put up a little example here, which is in our guideline itself, which is if you have a question in hospitals, this will fit with the asthma programme, do children with bronchiolitis who receive bronchodilators from nurses have better or worse respiratory function than those who receive glucocorticoids? So in terms of your PICO, you'll be looking at your population, being your children with bronchiolitis. You'll be looking at your intervention, your bronchodilators, your comparator, which would be glucocorticoids, your professional would be the nurse, your outcome would be your clinical scores, and your healthcare setting would be the hospital. So it's about trying to work clarity through your PICO. And if you have your PICO well set out, when it comes to revising your guideline, it will be very useful in terms of coming back and updating the evidence. In terms of the search strategy, I'll just very briefly touch on that because it will be dealt with more in the next session, which is around identifying your explicit search terms, your search limits, your inclusions and your exclusion criteria, searching for your evidence-based guidelines first, screening those guidelines, appraising them, and then applying a level of evidence for each of your guideline recommendations, searching for other evidence, and your economic literature search as well. So there's a whole process there that needs to happen, which is slightly different to how we would have looked for evidence and information before to inform our clinical practice guidance. If this is set up in a systematic, structured way, it will make it easy to update or inform the evidence going forward. So it's a very good, rigorous way to do that. And generally, it's really, really helpful if our librarians are sitting on your guideline development groups, are there to support you in this, because they're obviously the information experts around this. So in terms of next steps, as discussed earlier, you need to decide whether you want to adopt, adapt, or develop a new guideline from scratch. So we've talked a little bit about how you prepare your draft guideline. These are the kind of key things not to forget to include. So sometimes we really consider we need to get the evidence piece in. You really need to include your budget impact assessment, your resources required, your implementation plan, and think very realistically, what are the actual real barriers and facilitators and how they can be leveraged and utilised and how we can get over them. You need to communicate and consult, and often your communication and consultation will really inform your implementation plan and the barriers and facilitators. And it's good in your consultation to get a feel for your community who's going to be implementing these guidelines as to what those barriers and facilitators are in reality and in practice. And they will be different from your large tertiary hospital to your smaller community hospital. You need to communicate and consult and gain your external expert review, as we've discussed previously. Stages 3, 4 and 5 are around dissemination, implementation and evaluation. So creating that dissemination plan, and realistically a guideline isn't going to be implemented the first month or probably Q1 of whatever year it's been implemented. So there will probably be a staged implementation plan. You need to look at how you're going to monitor the implementation of the guideline and identify your audit criteria. And we do ask that you identify those audit criteria before you publish your guideline, which is why it's maybe useful to get your audit people involved at an early stage in your guideline, so that you have your audit plan in terms of if it's implemented in 6 months, how that's going to be audited, in 12 months, how it's going to be audited, and so on. Stage 6 is the process to update the guidelines. So you've got your guideline, it's through the processes, but actually who's going to maintain responsibility for updating this guideline? When are you going to update it? And we would at this stage say the standard is a 3-year rolling programme. We are looking into this because NICE and some other agencies have changed how they look at updating of national clinical guidelines, and we will update that as we go forward. And also to stay in touch with your librarian, who really is your best friend around all of this, because it is quite useful in terms of ongoing screening of evidence, in terms of is the evidence changing within 12 months, 24 months, so that you're not suddenly going to come up to 6 months before your guideline is for review and you really aren't on top of the changing evidence that's out there. So to recap on the guideline development path, we look at 6 stages, which is around planning, development, dissemination, implementation, evaluation and revision. And if we keep those in mind as each one important step as the next step, well then I think you give good attention to each stage as you need to do that. I think it's also clear as well from this that it takes a bit of planning in terms of how you're going to do and deliver this. So it's something that you need to stand back and think about when you take this on, how you're going to do it and to communicate that to your whole team, to your managers and to the system as well. Finally, as we finish this morning's session, just to wish you the best of luck, to say clearly we're here now and we have a bigger and stronger clinical effectiveness unit within the department. So we now have 3 clinical effectiveness officers who I'll introduce. That's Niamh O'Rourke, Rosarie Lynch and Sarah Condell, who have joined the department full-time to work on clinical effectiveness. So that significantly increases the resource and interactions that we can have with you. And our plan is that for each guideline development group, we would have a defined liaison person who will work with you, which hopefully make your process smoother so that they can attend some guideline group meetings if that's helpful to you. They can liaise in terms of requirements or issues or difficulties or facilitators that you might like to discuss with us. Do contact us early, so we'd encourage if you have other colleagues thinking about going down this route, come to us early, have a conversation with us and we'll try and help you and steer you on the path that you need to head on. Review all of our resources, they are up on our website here and we will be building this further and we'll be asking your feedback to say what was helpful, what wasn't helpful or what would be helpful going forward. Do complete the Agreed To tutorial if you haven't, and even if you've done it, it might be good to have a refresher, and do contact your librarian. And lastly, I'll just put up a screenshot of our website. As you can see, we have divided it now into 6 sections. So the first section is around the committee itself. So these are our governance processes, who's on the committee, what our terms of reference are, and our key governance documents. Our second section is on the National Clinical Guidelines, and you'll note we're theming it in a green colour, and you'll see our guidelines are in green for easy recognition and branding. So everything around National Clinical Guidelines would sit under that button. Our third one is for the patients and the public. So this is a section that we're going to build forward, but we have a frequently asked questions for our patients and for our public. We have a testimonial from one of our patients who was involved in one of the clinical guidelines as to what it was like. and we're going to create bigger resources there. And we've also collated there all of the patient information leaflets around the clinical practice guidelines, so they're easily accessible to the patients and to the public. Our fourth button is around national clinical audit, so we have a good bit to add here that we will over time. But what we are at the minute doing, putting up any literature reviews, information that's available there. So anything that's happening, you'll find out about national clinical audit there. We have a button on clinical practice guidance, and similarly, any information around clinical practice guidance is up there. So we did have a systematic literature review completed around clinical practice guidance, and that's up there, and it's a nice and interesting read for anybody who's interested in clinical practice guidance. And finally, lastly, we have our resources and learning, and this is a section that we're building so that we will build and add toolkits, and we'd love your opinions throughout the day as to what you would like to see up on this and what might be helpful to you in terms of helping you through the whole processes. So thank you very much and good luck with your developments.